Welcome back to One-Footed Phoenix. If it's your first time here, I hope you enjoy your time with us today. And if you've been here before, welcome back. Today we're going to be talking about some medications for chronic pain that can help people with CRPS and with phantom pain. These are non-opioid prescription medications that can help you with your chronic pain. LDN, or low-dose naltrexone, is often given to a patient before they start on opioids. This is because low-dose naltrexone cannot be taken in conjunction with opioids, but is often helpful in the early stages of CRPS. Low-dose naltrexone is meant to reduce pain and inflammation in the body, and it's a low dose given so that it can do its job, and given at a low dose, it's found to be helpful for CRPS. I don't know how helpful it would be for phantom pain, but it is helpful for CRPS. For me personally, I never found a low-dose naltrexone to be helpful. Unfortunately, I had an adverse reaction to low-dose naltrexone that caused me to go completely suicidal. Now, with that statement, I always put resources for suicide prevention in all of my videos in the description down below. You'll see that I have resources like the National Suicide Prevention Hotline and other resources such as NAMI and things like that can help you if you're struggling as well. But the most important thing to remember that if you're struggling with suicidal thoughts or feelings is to reach out and allow others to help you. Gabapentin is often used to treat nerve pain in patients with CRPS, phantom pain, and in patients with back pain. It's commonly used for all sorts of nerve pain conditions, and gabapentin is considered to be a somewhat safe medication, though there are a lot of side effects that you need to watch out for when starting gabapentin, like dizziness, headaches, blurred vision, and many, many more. As with any medication, you should always read the serious side effects as well as the minor side effects to decide if the medication is right for you before starting a medication. Lyrica is a stronger version of gabapentin, and it's considered to be absorbed into the body a little bit better than high doses of gabapentin. However, Lyrica does require blood tests and regular checkups to make sure that nothing's going awry within the body. For me, Lyrica didn't really work a whole lot better than gabapentin, and I didn't want to have all of the lab work done regularly on Lyrica, so I ended up going back to gabapentin. And on too high of a dose of gabapentin, my experience has been shaky hands and just overall shakiness. My current experience with gabapentin is that gabapentin does help to a degree with my phantom pain, and I definitely can tell when I forget to take my gabapentin because my leg hurts and it spasms like absolute bananas. And so taking gabapentin right now is something that's unavoidable for me, but I hope in the future to lower my dose of gabapentin and eventually even get off of gabapentin as I am able to walk more and as I get more used to my prosthetic leg. Cymbalta is a depression medication that is also commonly used for chronic pain conditions, especially ones that deal with nerves. Now with CRPS and phantom pain, Cymbalta is a medication that's commonly used. Unfortunately for me, Cymbalta did not go well. And when I mean it didn't go well, it had a similar effect of low-dose naltrexone, except for the effect just wasn't as severe. But it did eventually end up making my mental health destabilize, and it made depression actually worse, which is weird because Cymbalta is supposed to make depression better, but it did not make my depression better. So there's that caution right there, is the fact that Cymbalta didn't make my depression better, it actually made it worse after a few months. But Cymbalta is an option if you're struggling with chronic pain and if you are looking for an option that is not opioids. Something that has been helpful for me is lidocaine 5% patches. These are helpful for phantom pain. I didn't use them when I had CRPS because I'm guessing that the adhesive would be bothersome to someone with CRPS, especially if you have sensitivity issues. but I like these for help with phantom pain because the lidocaine kind of goes and gets into your skin, and then it just helps those nerve lines where I have a lot of phantom pain. Alright, so those are all of the 4 medications that I'm going to discuss today, and please remember that all of these medications are prescription medications. You do need to have some sort of pain management doctor to obtain these, and it's important to talk with your pain management doctor about what's working and what's not. It's definitely important that you have a pain management doctor if you're dealing with phantom pain or CRPS, and learning to advocate for myself has been one of the hardest things that I've done in my life. And I hope to expand on how to advocate for yourself with a pain management doctor in an upcoming course that I'm planning to put together, but that upcoming course won't be put together for a little while. It could be a couple months before that's put together, but it's something for you guys to look forward to, and I wanted to put it on your radar that is coming. Thank you everyone for coming and watching this video. I hope you enjoyed it and will consider sharing the information in this video with another amputee or someone with CRPS or someone that you know that's experiencing phantom pain. If you would like to see a video similar to this one all about how I help my phantom pain, click over here and I'll see you in the next video. Bye!